This is Dr. Rajiv Lochan, consultant cardiologist and head of the cardiology unit at Zahra Hospital, Dubai. And we just want to introduce about our cardiac facilities which we have. Before we go into that, we will tell you about what is happening about the heart disease in UAE. As such, we understand significant number of the patients have a heart disease, and it is, if we combine all together heart disease and blood pressure, cardiovascular stroke disease, it almost comes up to 50% of the deaths which occur in UAE are related to these diseases. So heart become very important and treatment is important. What we are specializing is, for example, is an acute treatment of the heart attack, which we have been accredited by JCI for the treatment of acute AMI treatment, and which means we treat the patient within a very short time. We take the patient in cath lab day or night, and our target is 90 minutes to open the artery, but most of the time in practice we have been able to achieve less than 60 minutes. So this is a great achievement of my team on the whole, because we have 3 interventional cardiologists. We are available around the clock. Sometimes we have more cases than one in one day, and our cath team is trained in that.
I am Dr. Behra Delahi. I am an interventional cardiologist working at Zahra Dubai Hospital. And actually, we have all the facility here 24 hours, 7 days a week, especially for the patient with a heart attack and acute myocardial infarction. And it's not only just limited to the common tools that we have, like a best brand of the stent or the best brand of the balloons that we already have it, but also we have some new devices, and we already know the new techniques, how to afford to open the blocked vessel that is very complex. Also, we have the IBUS. It's a catheter that we can go and see exactly inside the vessel of the heart, and exactly we measure the length of the blockage, and also we know the mechanism of the blockage that can affect our treatment for the next step and optimizing our treatment. Also, some other tools that sometimes routinely we use in some of the patients, like the FFR, that can be measured the pressure inside the vessel of the heart, that is maybe more than, it's the 2 millimeter diameter, and exactly this is good for the borderline lesion. Sometimes by the eye estimation we think the lesion is significant, we need to put a stent, but by the FFR we said, okay, this patient doesn't need any stent and we should defer stenting, and the patient doesn't get over-stented, and that is not necessary for that. And if I want to talk about the latest cases that we have done, I can tell one of the difficult cases that we have done here was a very hard calcified lesion. Even the balloon doesn't cross, and the balloon was ruptured in the vessels, and hopefully with the intravascular lithotripsy, that is a new technique, a new device that uses ultrasound to break and crack the calcium and open the heart vessel. Finally, we put a stent, and the patient was very happily and satisfied discharged from the hospital, because these cases was tried in 2 other centers and 2 times was failed, and we achieved this.
Okay. We are quite happy to have a big team, and all of them, we are interventional cardiologists, and we are complementing each other and completing the difficult cases and wide range of procedures which we are doing in coronary and non-coronary diseases of the heart. Thank you very much.